Okay, buckle up, listeners, because today we're diving headfirst into a real heart-stopper cardiac tamponade.
And trust me, you won't want to miss this.
We've got 2 up-to-date articles as our guide, Cardiac Tamponade and Diagnosis and Treatment of Pericardial Effusion. And to help us unpack it all, we've got the one and only, well, you know who you are, our medical maven extraordinaire.
Always happy to be here. This is a condition that can really sneak up on you or hit you like a ton of bricks, and believe me, you want to be prepared.
No kidding. All right, so let's start with the basics.
Yeah.
What exactly are we talking about when we say cardiac tamponade? It's not exactly a phrase you hear every day.
You're telling me. So picture this, your heart, the ultimate workhorse, pumping away, but it's being slowly, steadily squeezed.
Squeezed by what? A blood pressure cuff gone rogue?
Not quite. It's actually fluid building up in the pericardium.
Pericardium. Okay, time for a quick anatomy refresher. What is the pericardium again?
It's like a protective sac, a double-layered one that surrounds your heart.
Ah, right. And it normally has a bit of fluid in it, right? Like it's not completely dry in there.
You got it. It's like oil in a car engine, you know? Helps reduce friction as the heart beats.
Makes sense. So more fluid equals more problems. How much fluid are we talking about before things go south?
Well, here's the catch. It's not just about the amount of fluid, it's also about the speed at which it builds up, and that makes a world of difference.
So a slow leak versus, say, a burst pipe.
Exactly. A slow leak might give the pericardium time to stretch to accommodate the extra fluid, but a sudden burst, even a small amount, can cause the pressure to spike dangerously high.
And that's when we enter the danger zone, cardiac tamponade. When that pressure starts messing with the heart's ability to pump.
Bingo. It's like the heart's being put in a vice.
So what's actually happening in there? Is it like all the chambers get squished together?
It's actually even more fascinating than that. Think of the heart's chambers like, separate apartments. Normally, they function fairly independently. But with tamponade, it's like someone suddenly crammed everyone into one tiny room.
A cardiac game of musical chairs.
Kind of. And that wall between the ventricles, the interventricular septum, it gets pushed around in all the chaos, impacting how well each ventricle can fill with blood.
So instead of a peaceful apartment building, it's a free-for-all, with everyone fighting for space.
Pretty much. And this whole crowding issue, this ventricular interdependence, it's what causes some of the telltale signs of tamponade we'll be talking about later.
Sounds like understanding the domino effect is key. Okay, so we've got a sac, too much fluid is a bad thing, and the speed of the buildup matters.
Got it. But cardiac tamponade isn't just one thing, is it? It's not like every case is identical.
You're absolutely right. It's not a one-size-fits-all situation. We can actually break it down into 4 main types: acute, subacute, low pressure, and regional. Each one has its own quirks, you could say.
Oh, so it's like cardiac tamponade with its own little personality quirks. Okay, I'm intrigued. Let's put on our detective hats, shall we, and break down these different types. Starting with, let's say, acute cardiac tamponade. What makes this one stand out from the crowd? Acute tamponade is the drama queen of the group. It's the burst pipe scenario we talked about. Fluid builds up rapidly, we're talking minutes, and it's a sudden, severe hit to the heart's ability to function.
Yikes, that sounds intense. What kind of situations would cause this type of cardiac tamponade? Give us some real-world examples.
Think major trauma, car accidents, stabbings, things like that. It can also happen from a rupture in the heart itself or the aorta, even as a complication of certain medical procedures.
Definitely not subtle. So if you're a doctor in the ER, what are you seeing in a patient with acute tamponade? What are the red flags?
Well, patients will often have chest pain, difficulty breathing, their heart rate will be through the roof, and their blood pressure will plummet. It's a true medical emergency.
Sounds terrifying. What's the prognosis like for acute cases?
It can be very serious, absolutely. But the good news is, if we can relieve that pressure quickly, the heart can often bounce back surprisingly well.
So there's hope. Okay, that's acute cardiac tamponade, definitely one for the avoid at all costs category. Let's move on to subacute. What's different about this one?
Subacute tamponade is more of a slow burn, you could say. It develops over days, weeks, sometimes even months. Instead of a sudden crash, it's more like a gradual decline.
So more like a dripping faucet that eventually floods the bathroom.
Perfect analogy. And the causes here are often things like infections, inflammatory diseases, even cancer.
And since it's slower, I'm guessing the symptoms can be a bit more sneaky too, harder to spot right away.
Exactly. Patients might just feel tired, short of breath, some chest discomfort, maybe swelling in the legs and ankles. It's easy to miss or misdiagnose if we're not really looking for it.
Wow, so it's even more crucial to be aware of those less obvious signs. Now, regardless of the type of cardiac tamponade, what are some of the red flags that should make everyone, not just doctors, say, hold on, something's not right here?
Well, there's this classic triad of symptoms. Low blood pressure, distended neck veins, which basically means they're bulging a bit, and muffled heart sounds. But honestly, it's pretty rare to see all three together.
So we can't just rely on those three signs alone. There's more to the story.
Oh, definitely. We need to look at the bigger picture. Chest pain, shortness of breath, that rapid heartbeat we talked about, edema, those can all be clues. But here's the thing. Those symptoms, they're not exactly unique to cardiac tamponade. It's like trying to solve a puzzle where the pieces could fit in a bunch of different ways.
Right. Those symptoms could point to a whole bunch of things. So how do you, as the expert, know it's actually cardiac tamponade we're dealing with? What's your next move? It's like you're a medical Sherlock Holmes. So you got your magnifying glass out, you're seeing some suspicious clues. But how do you go from a hunch to a real live diagnosis of cardiac tamponade? What are the tools of the trade?
Well, it all starts with a good old-fashioned clinical eye, listening carefully to the patient's history, doing a thorough physical exam. But to really know for sure, we need to bring in some reinforcements. One of our go-to tools is an electrocardiogram. You've probably heard it called an EKG.
EKG, yep, rings a bell. What can that tell us?
It measures the heart's electrical activity, right? So sometimes with cardiac tamponade, we see this thing called electrical alternans.
Electrical alternance. Sounds like some kind of futuristic dance move.
Right. But seriously, it's a distinct pattern on the EKG that can be a strong indicator of tamponade, although we don't always see it.
So EKG, possible clue, but not a slam dunk.
Yeah.
What about actually seeing what's going on around the heart? Can we do that?
Oh, absolutely. That's where the echocardiogram comes in the echo. This, my friend, is the MVP when it comes to diagnosing cardiac tamponade.
The echo. What makes it so special?
With an echo, we can actually see the heart being squeezed by that excess fluid. It's like watching a live-action movie of what's happening inside the chest.
Whoa, that's incredible. So you can literally see the pressure, how it's affecting the heart's movement.
You got it. We can see if the chambers are collapsing, how the blood flow is being restricted. It's really remarkable.
Okay, so if the echo shows the heart doing a sad, squeezed little dance, you know it's time to act fast. And speaking of acting fast, let's talk treatment. What's the game plan for relieving that pressure and giving the heart some breathing room?
The name of the game is getting rid of that excess fluid that's causing all the trouble. And one of the main ways we do that is with a procedure called pericardiocentesis.
Pericardial what now? Okay, that one definitely requires a pronunciation guide.
Pericardiocentesis, yeah, it's a mouthful. But the procedure itself is actually pretty straightforward.
All right, break it down for us. What actually happens during a pericardiocentesis?
Basically, we use a needle to carefully drain the fluid from the pericardial sac.
You're sticking a needle into the heart.
Not into the heart itself, no. It goes through the chest wall and into the sac surrounding the heart. And we use imaging, like ultrasound, to guide us every step of the way.
So you can see exactly where the needle is going. That's reassuring.
Absolutely. Precision is key. And once we're in the right spot, we can drain out the extra fluid, kind of like letting air out of an overinflated balloon. That relieves the pressure on the heart and lets it do its job properly.
It's like an emergency release valve for the heart. Okay, that makes sense. But what if pericardiocentesis isn't enough? What if the situation is more complex and you need to bring out the big guns?
You're right. Sometimes pericardiocentesis isn't the answer. If the fluid is really thick, for example, or there's a lot of bleeding, we might need to go in surgically.
Surgically. So open heart surgery.
It's not open heart surgery in the traditional sense. We make a small incision, create a window in the pericardium, which allows us to drain the fluid more effectively.
So it's like getting eyes on the problem, figuring out what's really going on in there.
Exactly. And that's important because treating the tamponade itself is just one piece of the puzzle. We also need to figure out what caused the fluid buildup in the first place.
Right, because if you don't fix the root cause, the problem could just come back again, right?
Okay.
So what are some of the usual suspects when it comes to pericardial effusion? Why does fluid build up there in the first place?
It's like solving a medical mystery. It could be an infection, an inflammatory disease, even cancer. We use a whole range of tools to get to the bottom of it: blood tests, imaging, sometimes even a biopsy.
Wow, so it really is detective work. But once you've drained the fluid and you're working on addressing the underlying cause, how do you know if the treatment is working? What does recovery look like for someone who's had cardiac tamponade?
Well, we keep a close eye on them, of course. We want to see their blood pressure stabilize, their heart rate come back down to normal, their breathing become easier.
Those are all good signs?
Yeah.
But is that it? Or is there more to the recovery process?
Oh, there's definitely more to it than that. We often monitor patients for a while, sometimes even leave the drainage catheter in place for a bit, just to make sure that fluid doesn't start building up again.
Makes sense. You don't want to take any chances.
Exactly. And we'll use echocardiograms to keep an eye on how the heart's recovering, too. It's all about monitoring, managing, and really supporting the heart as it recovers from this pretty intense experience.
So it's a journey, not just a quick fix.
Exactly. And remember, we're not just treating the symptoms here. We're aiming for a complete solution by addressing that underlying cause. Because even if we relieve the pressure today, if we don't figure out why it happened, it could all happen again.
Which brings us to a really important question. What are the long-term implications for someone who's experienced this scary condition? Is it possible to make a full recovery? Or is there a chance of lasting damage? So we've drained the fluid, we're working on those root causes.
Yeah.
But what's the long game here? Can someone who's gone through this, can they bounce back completely?
Well, the good news is the heart is a real trooper, It's incredibly resilient.
That's good to hear. But I know you mentioned earlier that it's not always a one-and-done deal. There can be long-term implications. What did you mean by that?
You're right, it's not always smooth sailing. Sometimes, especially if the tamponade was really severe, or if it went undetected for a while, the heart might not bounce back 100%.
So even if you address the immediate problem, there could be lingering effects down the line.
It's a possibility. Some people might experience heart failure, meaning the heart struggles to pump blood effectively. Others might develop arrhythmias, which means the heart's rhythm gets out of whack.
Okay, those sound pretty serious.
They can be, yes. But here's the important thing. Even with those potential challenges, there's still a lot we can do to help people live full, active lives after cardiac tamponade. We have medications to support heart function, lifestyle changes that can make a world of difference, and even those implanted devices like pacemakers and defibrillators that can step in if needed.
It's amazing how far we've come, giving people that hope, even when facing something so serious.
It really is incredible. And it all comes back to something we touched on earlier. Early detection is key. So many cases of tamponade stem from these underlying conditions, infections, inflammatory diseases, even cancer. The sooner you find them, the sooner you treat them, the better the outcome, both in the short and long term.
An ounce of prevention is worth a pound of cure, right? Knowing your family history, listening to your body, those regular checkups, that all matter.
It makes all the difference. And hey, even if you do find yourself facing this condition, knowledge is power. Understanding cardiac tamponade, advocating for yourself, working closely with your healthcare team, it can make a world of difference.
Couldn't agree more. Well, we've certainly covered a lot of ground in this deep dive, haven't we? From the nitty-gritty mechanics of a heart squeeze to the importance of early detection and that potential for a strong recovery.
It's been quite a journey exploring all the facets of this condition.
It really has. And I think it just highlights how remarkable the human body is, especially when it comes to the heart's ability to adapt and recover. It's pretty incredible.
Absolutely. The heart is a fighter.
We started with a squeezed heart, but we're ending with a sense of hope. And I think that's what's important. And for our listeners, a whole toolbox of knowledge, that's what the deep dive is all about. So until next time, stay curious, stay informed, and keep those hearts happy and healthy.